All right. All right, you ready? So, good evening, Dr. Yvette McQueen. I'm glad to have you here today. Sustah-Girl Chronicles, we're going to talk about life for women over 50 and how I want us to thrive. So, we're going to talk about some of the top health issues that we may have to deal with once we turn 50 and 50 and over. So, since you are one of my experts, I'm gonna I'm gonna let the audience hear all about what we should and should not do, and some of the things that we should look for as far as our health. So, tell us a little bit about yourself and some of the things that you do, about your travel, about your medical experience, and all of that.
Okay, so hi everybody. I'm Yvette McQueen, MD, a global physician on a mission to educate about health, travel, wellness, and disease prevention. So I'm an emergency medicine physician for 20 plus years. And I've been traveling around the United States and Caribbean, working at different hospitals. And I also am a global traveler in which I take groups of travel. I own the company Med Queen Tours, so I am a travel advisor for personal concierge travel. But I like to do cultural immersion trips for people, and I take them on trips. If you're a physician in my group, I will give you continuing medical education credits, so it can be worth it. And that's what I do.
Wonderful, wonderful. Yeah, I've seen some of your experiences, and they look great. So let's get into our little topic about some of the top health issues. I noticed after, even before I turned 50, I noticed some changes happening.
Mhm. Mhm.
And it's like, what is going on with this body? So let's talk about some of the things we should look out for.
Okay, so um, menopause can be a 2-hour subject. So I'm not even going to braze on that. So that's another topic. But the main thing you need to think over 50, the leading death in women is actually heart disease.
Wow.
So it's heart disease, cardiovascular disease. So that's the one, particularly if it runs in your family. So one thing I always say is you should know your baseline. So that's why annual visits to your doctor is important, and not just your OB doctor, because if you still got the uterus, you go to your OB doctor, but you should also have a primary care doctor that's going to take care of everything else. So you should have control of you should know what a normal blood pressure is. Normal blood pressure is 120 over 80. No, not 130, not 140, what some people accept, but we need to stop accepting that
Mm.
in the United States, because the United States is known to we have higher blood pressure, stress, the way we eat, processed food. But so you should know your numbers. So this is one thing I always say. Of course, people say weight, but it's more the BMI, and you can have that you can find that calculation. It's a calculation what your BMI is. That makes a difference of whether you're obese. So you ever hear people, oh, they're obese, moderately obese, morbidly obese. It's all about your waistline. Your BMI is what determines your obesity level, and it actually affects the insurance. So if you have some of these insurance companies will start penalizing you or charging you more for your insurance, or say they're not going to cover certain things if you don't take care of it or reduce it. So know your BMI, know what your blood pressure is. And I tell people everybody should have a blood pressure cuff at home, but they're readily available at a lot of the pharmacies or the drugstores, Walmart, things like that.
Mhm.
One good thing is to know if you have one at home, which you take it in the morning and evening and night, so you can know if different things during the day change it. You should know your cholesterol level, and that means you've gone to a doctor and they've done blood work. Okay, so there's of course high cholesterol level, your LDL versus your HDL. One is the L is considered the bad cholesterol, and the HDL is the good cholesterol that increases as you exercise. So that actually is the good number. So you should know what your total cholesterol is, and then and that makes a difference. And that always weigh in how effective, how much you're at risk for heart disease. So, like I said, once again, number one killer. You should know your family history. And some people you're not able to know because you either adopted or never knew your parents, or there's only one person. And unfortunately, and I'm gonna tell you, in the African American population, we have a tendency of not sharing information.
True.
We need to get out that habit, like, oh, I remember Auntie so and so. I remember her being in the hospital and died, but what did she die from? So, like with cancer history, everybody think breast cancer is the number one in women, but it's not. But it's good to know if that's in your family history. Heart disease is one of them. Got questions about that?
Yeah, well, because I usually do my cholesterol, check my cholesterol because it has been high, and history, heart disease runs in the family.
Mm-hmm.
Should you always fast before that test, or no, or does it matter?
Okay, so some tests you do need to fast before, and that's one of the tests you do need to fast before, and they'll tell you 8 hours fasting or 12 hours. Usually it's like nothing after midnight if you're getting the test done at 8 o'clock in the morning, which is the good time is between 8 to 12 hours of fasting. So yes, that is one of the numbers you have to fast ahead of time.
Yeah, I always try to make that appointment early in the morning,
mm-hmm.
so that that 8 to 12 hours after, I'm not starving and I'm more tempted to eat.
Right. A lot of people do it now too because they do the intermittent fasting. Some people do the intermittent fasting, and that's once again a whole nother hour about how you're really supposed to have 12 hours of not eating. So 12 hours of not eating is, say, if you eat at 8 o'clock at night, then you're not eating again until 8 o'clock in the morning. That's the normal fasting. You remember, you think of breakfast.
Mm-hmm.
Breakfast means break your fast. Yeah. So if you look at any of the old English movies or something, you're like, oh, you get to break your fast. That's how breakfast came about. So you really supposed to, but now people are intermittent fasting where they're stretching that 12 hours to 14 hours or 16 hours. And so some people are like, I don't eat until 11 o'clock at night. So that's great that they can do that. I can't do that. I'm being honest with you. I can't do that. But that's a good way of, getting your blood work done in the morning. So I talked about the numbers. Know your blood pressure, know your cholesterol, know your BMI, which usually you want it. I think it's 25 for men, 28 for women. I might need to go back and look at that.
Mm-hmm.
Your waist circumference, which you take a measuring tape, and your waist is right below your belly button, if you can find your belly button. So that should be under 35 inches. The next number that you should know is your they'll say blood sugar number, but I like to check people's hemoglobin A1C. So your hemoglobin A1C tells me what your normal blood sugar has been doing for the last 90 days. When it says hemoglobin, you have two different cells in your blood, the red cells and the white cells, and the hemoglobin is attached to the red cell. And there's they can actually test that and say, hey, what has your blood sugar been running for 90 days? Because I'm just going to be honest with you, people come like, oh yeah, my sugar's been good, and they'll be fasting and their blood sugar will be good under 90 or under 100. But you get that hemoglobin A1C that can tell me what it was in the last 90 days.
Wow.
No. So hemoglobin A1C is how we determine diabetes. Mm-hmm. So hemoglobin, you want it 5.6 or under. Okay, 5.6 or under. 5.7 to 6.3 is considered pre-diabetes. And nowadays, a lot of people are starting to treat diabetes as pre-diabetes. Before it was like, oh, let's change your diet, let's do this. Nowadays, some people are actually putting you on medicine, particularly if there's family history or you have a risk of being in a metabolic syndrome, so that you don't progress to diabetes. Anything over 6.4 and above is diabetes. So people come in and be like, oh, well, my hemoglobin has been running about 6. That's pre-diabetic. But my doctor won't do anything. They need to do something. They'll come in
Mm-hmm.
and say, oh, my blood sugar is 200. That's diabetes. I mean, when I see them in the emergency department,
Mm-hmm.
their sugar's in 300s, they're like, oh, well, I just ate a meal. No. Just eating a meal, and it comes in, and we'll take like between 150 and 200 because it's supposed to go down. But anything over 200, that's automatic diabetes for me. No, that's automatic
Wow, wow.
diabetes
And
for me.
that's another disease in our community that is just pretty rampant. And again, knowing your family history is so important. My stepfather, everyone, he and all of his siblings were diabetic.
Okay. Yeah, no, right. But nowadays we're finding that more and more people are not, they didn't have it in the family just because of the American diet.
Wow. Yeah.
Yeah, people have developed it because of the American diet. So, and the problem with the heart disease and diabetes, it the the things that come after you having the disease is the point. So if you're not controlling it, heart disease will end up having heart failure, and it puts you at risk of strokes. Okay. Diabetes puts you at risk of increasing more risk of heart disease. It increasing you having kidney failure because that happens. The sequelae of people that has uncontrolled diabetes for years end up having kidney failure, going on dialysis. You end up having what they call neuropathy of your fingers and toes, and that's how people end up getting basically limbs cut off because your nerves, it deadens the nerves. You can't feel things. Someone step on a nail, they don't know they step on a nail, it becomes affected. Next thing you know, you look and go, where did my foot get infected from?
Yeah.
That's what happens. And then the other one we look at, it causes blindness. So retinal deterioration, and
Mhm.
it can easily cause blindness.
Wow. That's a lot. But um, I even noticed, no, actually, I was talking to someone last weekend. And she was representing an organization that works with kidney disease, and she
Mhm.
was saying that younger, and it's getting younger and younger with people coming in with the disease, and she's talking to them about changing some of your habits, and do you know your family history and things like that. And I was just surprised at how young, because she even talked about some people in their 20s.
Yes, and I'm be honest with you, when it comes to heart disease, high blood pressure, I've diagnosed people in their 30s with a stroke.
Wow.
So we always be like, oh, that's because they're older, they're having a heart attack. People are having heart attacks and strokes now in their 30s.
That's scary.
That is scary. That is scary. So those are the things that you do need to look for. And then you're like, oh, that's so ominous. I'm just, what's the point?
Mhm.
Because we can control our health. We can control our wellness. So even if we do have family history, we can control it. First of all, once again, know your baseline, have an annual physical. Sometimes every 6 months, if you do have a disease going on, with a doctor that's going to manage it. And I'm going to tell you something. If you feel your doctor is not listening to you, and you feel your doctor is not taking care of your problem, get another doctor.
Get another doctor.
Get
Yep.
another doctor. I'm serious about that because there's good and bad in all professions, but they should be taking care of your diabetes and your heart disease and anything or preventative measures. I mean, do you have risk factors of breast cancer? When was your last mammogram? Because over 50, things you need to do over 50. You need that mammogram, you need your eye exams, you need that colonoscopy.
Yep. Get that mammogram every year.
Yeah. So yeah.
Every year. And, you know, the doctor should be, at least in your annual, doing some blood work.
Yes. Exactly. Doing some blood work. Not just saying, "Oh, we're gonna listen to your heart. Oh, you okay? You have any problems? Okay, bye." And they send you out. No, that's not it.
No.
And two, they should be doing what we call a mini stress. They now call it. What do they call it? It's like a mini mental health
Mhm.
quiz that you're supposed to do and find your stress level. and just find out if there's things that they need to gear you to. Because a lot of people, your doctor is supposed to be where you tell the truth.
Well, where you should tell the truth, but
Where,
I know my parents. You would go to the we would go with them at a certain point,
right.
and because as soon as the doctor said, "Well, what's going on?" "Oh, I feel all right."
I'm fine.
Uh huh. No, 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 doc. She's not fine. Let me tell you what's going on. And
Right.
so, and then, when they say on a scale of 1 to 10, what's your pain? And if it's really 10, say it's 10.
Oh, it's just a 3. I have it. No, it's not. That wasn't it last night, was it?
You were all
you,
bent over like, oh my God, help me, help me.
and you calling me, right?
Exactly, exactly. Or if the doctor said, "Oh, it won't hurt that much when they do a procedure," if it hurts, you ouch,
Just
it
say it
hurts,
hurts. It hurts. It
it,
hurts.
it
Yes.
hurts.
Yes.
Exactly. Now, what about osteoporosis? Because I know I hear a lot about that, along with menopause, of course.
Okay, so osteoporosis, in women, they say as you estrogen is a protector for osteoporosis. So when your estrogen start to decrease, which it decreases with either after a hysterectomy or if you've had your ovaries removed. That's why with some hysterectomies they keep your ovaries because they want you to have the estrogen. But if you've had ovaries removed or you're going through menopause and your estrogen levels start to decrease, then it's no longer protective of your bones. So once again, family history. If people's had family history of bone problems, you're elderly, either had like connective tissue disorder, rheumatoid disease, spinal problems, you see them bent over, consider that they may have osteoporosis. That means that your bones has, if you think of something hard and then inside it has like a little cushion. You ever look at a picture of a bone? It's like a hard shell and then it looks like a sponge inside of it. It's the spongy part inside that starts to soften and makes the bone bend for osteoporosis, but estrogen usually protects it. So then that's another discussion with your doctor, primary OB, whoever it is, whether you're going to be on, of course, hormone therapy. But we all know there's risk factors of being on hormone therapy, whether you do have a history of cancer, your breast cancer in your family, or you have a history of blood clots, things like that. But that's a discussion you need to have with your doctor. So that's what osteoporosis. To keep osteoporosis, of course, I recommend multivitamin for everybody, and there's several different multivitamins. Whether you're doing the women's multivitamins or the over 50 vitamin, just a multivitamin for it. Doctors are now checking your vitamin D level. So sometimes you do need to increase your vitamin D level by taking a supplement to it. And that will keep your bones stronger. But activity, and this is one good things for the first thing you need to do. So when I give people my wellness tips, one is hydration. It's always going to be hydration first. Hydration is going to help you with everything, except if you have heart failure and you're on a fluid restriction. But otherwise, drink your water, and not the sugary, not the sodas. And you want to stay away with things with lots of bubbles because that only increases your acid reflux in your stomach. Water, please. These sports drinks, Gatorades, all that has lots of sugar in it. Don't do it. And avoid the sugar substitutes too, because you start to take the sugar sweeteners and the substitutes. That's only going to want you to drink more and eat more.
Interesting. Well,
Actually,
I don't use any substitutes at
yeah,
all.
it triggers the brain. It triggers the brain. So you don't want to do that. So yeah, so water. Drink your water. You can have a little flavor. Put some fruit in it. Put some cucumbers or lemon or something.
Mm-hmm.
But yes, stay hydrated. Okay. Second is stay moving. You got to stay moving. Move, move, move. And that's going to help with your bones. That's going to help with your cardiovascular. That's going to help with your diabetes. You got to keep moving. Now, a lot of people are like, oh, well, do I need to get a gym? No, I'm allergic. I'm telling people I'm allergic to exercise. I am. I'll go to a gym and I'll say, okay, I'm going to do it for gym. And I'll do it for maybe 1 week, 2 weeks. And then something happens and I'll fall off or I'll go on a trip and I'm not working out again. It takes me months to get back. So, but I move. I'm a walk. I definitely gonna walk. So make sure you're walking. Make sure you're getting your steps in. Make sure you. And sometimes it's around the house. I mean, I have steps here, and I always make sure. And I have very steep steps here. I make sure I go up and down them at least 10 times a day. I mean, you just got to start, and you got to start baby steps. So if you have not been exercising and you have not been moving, you don't say you can't climb Mount Kilimanjaro next week if you haven't been exercising or training for it. So you have to do baby steps to get where you want to. So stay hydrated, stay moving. And then, I gotta talk about food.
Yes. We know we don't always eat the best.
You know what? Especially too, when I have people change diets for, like, if they're changing diet for high blood pressure or diabetes, cutting things out only makes people want it more. So you have to be able to reward yourself. So I say it's all about moderation. So, but definitely you want to cut out the fried foods. So fried foods, I mean, you can have it. Say you can have fried foods once a week. I mean, I had to cut out French fries because French fries is my culprit. And I mean, I was the one. I'm just gonna roll over here to McDonald's. Right? I don't want anything else. I'm just getting the French fries. And then as I got in the 30s, I'm a roller. Then I'm like in the 40s. I was like, okay, this isn't working the same way. So I tell myself I'm only gonna have it, once a week or twice a month or whatever, what I've told myself, so you moderation. So, but your plate. So when you go to your plate should be colorful. Half of your plate should be vegetables. Half of your plates should be vegetables. When you're eating your meat, your protein, it may not be meat. You may be a vegan or veg. So your protein should be 4 ounces. They say 6 ounces for men, 4 ounces for women. And so that if you look at some meat, that could be like the palm of your hand. Think about something, the palm, a piece of chicken, a chicken thigh, or whatever you use it. So when you go to these restaurants and they be like, yeah, we have the 12-ounce sirloin. Nobody needs to be eating that.
Not that much meat. No,
nobody needs to be eating that. So that's what you want to. And then your carbohydrates would be the other quarter of your plate. So if half your plate is vegetables, once again, make them colorful: green, red, yellow, whatever it is. The other quarter is your protein, and the other quarter is your carbohydrate, whether it's rice or potatoes, but that should only be half a cup. That should be a half a cup, not piled up. Okay. And if you want to make your mac and cheese, but make it a half a cup. Okay. That's what you got to do. And that's just, once you get yourself in the habit of doing that, you get used to that. Remember when back in the day we used to in elementary school, and I'm dating myself, back in the the divided plates, the divided plates. And so that's what they've come out with now to help you divide your foods, your vegetables, your protein, and your carbohydrates, because that's how where they're supposed to be, instead of everything
piled on.
Right. And consider some quick changes you can do is getting smaller plates to eat at dinner. They instead of the 10-inch plate for your dinner plate,
an 8-inch.
Yeah, 8-inch or 6-inch, right? Yeah.
I love vegetables. But my mother, when she always made sure whatever protein, whatever meat, chicken, fish, she had at least 2 vegetables.
Right. Exactly.
So we had to eat vegetables all the
That's what you
time.
have. Yeah.
But I love, and then in the summer we had our garden. So I love the freshness of the vegetables and everything. And
Yeah.
now I do love some fried food. I have cut back on that tremendously. I hardly ever eat fried, but occasionally I want some fried
But
fish.
but there's ways of changing that now. What about the air fryer? Instead of frying it in the deep grease that we used to, or you frying that, that that stovetop bacon grease. I'm reaching back because I know there's some people out there know what I'm talking about.
Yes.
But air fryers. So I know sometimes I was like, oh, I wanted some chicken tenders. So I took the chicken, cut it up. I used panko. I didn't use straight bread, because sometimes people glue, but I used panko breadcrumbs, put it in there, put it in the air fryer, and it came out tasting just like regular chicken tenders.
Really?
Without being greasy. Okay. That greasy is going to be your saturated fat that's going to increase that LDL level.
Okay, I'll try. And I have an air fryer. It does a little bit of everything. It's an air fryer. It does slow cooking. It does what's the other? Pressure cooking. It does a little bit of everything.
Yeah, I mean, you can put your bacon in there. Just consider. Actually, you can put everything in your air fryer. Believe it or not.
I'll try that. I'll try.
Yeah.
Something in there.
And I use, like, if I want some fish, like you said, fried fish. Sometimes with my fried fish, I'll start it from frozen. If you start it from frozen, then that keeps the moisture in. So I'll get the fish and I'll put some olive oil, not grease, but olive oil on it, season it, put it in there, do the air fryer, turn it over, air fry, and it comes out like fried fish.
Okay, well, we will try that. And I love a good salad, but we also have to be careful when we're talking about food. It's piling on salad dressing.
Yes. So one thing, I've started looking at the labels more, and you got to start looking at your labels. So things we like, oh, it's just salad dressing. One, how much sugar is in that salad dressing? And two is like, what are the ingredients? So I recently have an aversion to soy. So I've reduced the soy intake. And I'm looking at things, and you would be surprised how much stuff has soy. And I'm looking at all the salad dressing. They're like, why is that soy based? Soy based. So I've come down to just like some of the vinaigrettes now. But yeah, salad dressing. Salad dressing, when you put salad, you have a salad, which is a normal bowl, not your mixing bowl. Not your mixing bowl. I probably should have some bowls here for some props. But a salad in a bowl, it should be 1 to 2 tablespoons of dressing. That's it.
Yeah, that's it.
Guilty. Once again, does it include sugar? So in things that you put on, or you think about your toppings that you put on. So I get a salad and I'll put a lot of toppings on, once again, make it colorful. I like the green peppers. Here's my trick. The way I was able to give up potato chips. I eat the sweet pepper rings because I realized it wasn't the potato chips I wanted. It was the crunch.
Yes.
It was the crunch I wanted.
Guilty.
So I start eating the sweet peppers, which gives me the crunch. And I was like, oh, this is just as good. That's all I needed.
And carrots give you a crunch too.
Yeah. Carrots can be a little bit hard on your teeth.
In the back.
Yeah. Make sure you're visiting your dentist. That's another thing.
That's another
oral health is very important. It is connected to heart disease and diabetes, believe it or not.
Definitely.
Yeah.
It definitely is. The other thing I saw, which I was surprised about mental health, once women turn 50 and over, they start to become a little more depressed, or sometimes it's the loneliness. And that was something that I understand, but it was something that surprised me, that it was kind of up there on the top. Not in the top, but at least in the top 10.
So yes, mental health is actually in the top 5. Especially, so it's kind of multifactorial. So it deals with like you come over 50 and are you starting to have diseases and problems, and then you be like, oh, why was I diagnosed with that? Daggone it. You're at a point in your career that either you think you should be doing more,
Yeah.
or you got to a point where you just can't tolerate it anymore, whatever you're doing. Okay. So then you're upset about that. And then as you start to use your estrogen is very protective. Estrogen protects that brain, and it starts to reduce your dopamine levels. So dopamine is the happy drug in your brain. Dopamine is what makes you happy. Dopamine is, you eat chocolate and feel good, that's dopamine. You have sex and feel good, that's dopamine. Decreased estrogen decreases your dopamine. So
Wow.
yeah, so then you start to feel less happy, worn out, more fatigue, and then that brings on, well, what am I doing with my life? So yes, people you can have more depression over 50 because of just multifactorial. Is it related to chemical? Yes, but it's also, where am I in my career? Am I happy? Okay, now I just got diagnosed with this. Now I got to worry about this. And also, women in their 50s are in that sandwich family. They either got kids and they got a parent they got to take care of.
Exactly.
And you're just like,
you're pulled in so
yeah,
many directions,
right.
and there's no time for you.
So you do have to think about your mental health. Everybody should have someone they can talk to. I'm a proponent of counseling. If your insurance doesn't do it, or you can't afford counseling, find a pastor. There's so much things now with the apps and the Headspace and things like that. The one thing I do say so I'm in a medical profession. They've changed it somewhat, but it's still taboo for doctors to get mental health. So they say, oh yes, make sure you're getting counseling, make sure you're doing that. But when we go to apply for credentialing the hospitals, one of the questions they say, have you ever been treated for mental health?
Wow.
And it goes ding. Well, let's go send that to committee and think about that some more. Wait a minute, this is the profession I'm in. Are you kidding me? So after the pandemic, and all of us needed help.
Everybody, yes, okay. Especially medical professionals.
We all needed that. They kind of relaxed on some of those questions they asked us about that. Because like, we all need to talk to somebody about what's going on in our life. We do.
Oh, yeah. And the stress that you're under. You know, patients that are ill, it's like that secondary trauma.
It's a secondary trauma because you have, I tell people that I have a problem with customer service. Customer service isn't great, but it's people should still care about their job. So if you go into the fast food and they're not making your hamburger right, then they'd be like, oh well, okay, whatever. I was like, if I had that attitude when you came up to my hospital, someone would be dead.
Exactly.
If I was an airplane pilot and I had that attitude, oh well,
so the plane is crashed.
That's not working. Oh well, we'll just do that next time. The plane wouldn't work. Yeah. Hello. So you have to. Yeah, it's a secondary trauma of knowing that someone's life is
in your hands.
Yeah,
in your hands. Mm-hmm. Just a couple of more. Of course, the big C, cancer, is up there on the list. And there's so many different types of cancer. But of course, as a breast cancer survivor, I try to tell people all the time: make sure you go get the mammogram. Make sure you advocate for yourself, because if you miss 1 year of a mammogram, who knows? You might have just missed
it. Well, we just saw the young lady, the
from Beat.
Yeah.
And she did not want treatment.
Well,
she was scared because.
She actually did have some treatment. It's the way they report it, because I actually know her sister.
Oh, you do?
Her
Okay.
sister's a physician. So she actually did have treatment. She did not have the full radiation therapy kind of chemotherapy that most people, but she had some treatment.
Okay.
She did have
That's
some
good to
treatment.
know.
But by the time she had found out the first time anyway, it already was progressed. Is the point. So a lot of people feel, oh, I'm in my 20s. I don't, yes, they don't say in your 20s you need to have a mammogram, but if you come back and say woman in my family have breast cancer, they should be checking you early on. Okay.
Yes.
So yes, the cancer. And then some people just forget about the other cancer. Yes, breast cancer is high. But just once again, family history, colon cancer, pancreatic cancer takes us out. Once you know pancreatic cancer will take you out fast.
Fast. I know that. I've had cousins, a couple of cousins.
Yes.
Within months, gone.
Because by the time they detect it, but there's numbers you can do. I mean, ovarian cancer, uterine cancer, your doctor can do some blood work, check your CA 125, these different numbers they check, you can have checked.
Yeah. But then again, advocating for yourself, knowing your body too. I always tell people, know your body. So if you're getting certain pains in certain areas or certain pains down there, then you need to go get it checked out. It's not that, oh, it's going to go away. Oh, it just hurt a little bit. And then the next thing you know, it's too late.
Or spots on your arm or whatever, because melanoma is missed a lot, particularly in our population. So just you find new bumps or new dark spots. You should have a dermal check. Right.
Yeah, I had a dermal check last year because I have a little bump on my leg, and my sister who's a nurse, she's like, girl, you better go get that checked out, So yes, I did. Fortunately, it was not, I guess it was, age thing, but the point is I had to make that appointment, and getting an appointment with a dermatologist
is hard. Like here, I don't know, you can see a camera. There's this spot on my arm right here. Everybody see this?
Yeah.
So everybody wonder about, and they be like, oh my God, they look at it, you have this check. But point is, I know what this is from. I burned myself almost like 15 years ago. So I know that's a burn scar. But it does look like a melanoma scar, a melanoma bump. It does. And people have seen this. It's like, oh, have you looked at that? But once again, know your body. I know I burned myself there.
Exactly. And then my esthetician, she reminded me, when you're putting your sunscreen on your face, to make sure you get your ears, because that is a spot where they're finding.
Back here too. So sunscreen, when you put on sunscreen, make sure you put in sunscreen on 20 minutes before your exposure. Not like, oh, I'm going out, or I'm already out on the beach, let me put it on. No, it should be put on 20 minutes before your exposure, okay? Renew that sunscreen every 2 hours or after you've been in the water. That's my little speed. But yes, so sunscreen all that on top of the ears, the back of the neck, don't forget, and if you have some bald spots, you either wearing a hat. I mean, every now and then I was losing some hair, menopause. Once again, you lose estrogen, and I knew I had some little bald spots. I would stick
some in there,
right?
Don't forget your toes and your feet.
All of it, whatever's exposed, whatever's
on.
Yeah,
put it on.
Yeah.
Bladder issues, because we all know. If you're over 50 or over 60, you're going to have to go to that bathroom.
Yes, that's one of the things that your doctor can have. There's actually tests for that now where they can measure the actual muscle tone of your bladder. So if you do have some leaking, tell your doctor. They understand it. Don't be embarrassed about it. And that's why they make the whatever poise, always pins. Get it.
Don't be ashamed.
Don't pay it, and so you're not embarrassing you walking down with a spot on your pants.
Right.
But is known that your bladder tone decreases with age. Once again, it's no longer protected. And definitely if you've had a hysterectomy. You've had children, your bladder, the more children you have, the more weakened that pelvic floor.
Yes.
It's that muscle, the floor, it weakens. So when you're laughing, when you're sneezing, when you're coughing, you can have small accidents. So they can actually measure the muscle tone. And now this, I forgot what it's called. It's like an ultrasound machine. It's a procedure they can do in the office, non-invasive procedure. It's an ultrasound machine that they do that strengthens the tone of that pelvic floor for your bladder.
Oh, that's interesting.
Mm-hmm.
Okay. That's good to know. I'm sure women, I had not heard of that. So that's something that, our audience can
Yeah,
ask.
you can say if you go to your doctor and say, "Look, I've been having some leakage. Is there something? Is there a type of ultrasound procedure?" That's all you got to say.
Right. And beware of how much water you drink at night.
Yes. Because of course, some people are on a diuretic or water pill. You want to take that in the morning. But yes, some people need to be cautious of the water they drink. I would say at least good 2 to 3 hours before they go to bed. Because then, once again, it interrupts your sleep.
Yes.
So if you get up in the middle of the night to go pee, trip hazards. That's how I always get my 70 or 80-year-old getting up, going to the bathroom. They fell and now they have a hip fracture. That's what comes into me in the middle of the night. But so, and two, it interrupts your sleep because you want the uninterrupted sleep. Every adult should have 7 to 8 hours of uninterrupted sleep. So if you're waking up with your bladder, that's interrupting your sleep. You don't have good sleep. You increase your cortisone level. Guess what that do? Put you at risk for heart disease and diabetes,
blood pressure.
Decreases your immune system, so you can get sick.
All of those things just have an effect.
The body is so interconnected, and it's like, who made this body? Okay.
Where did it come from?
Who made this creature where everything is so intertwined that it works together in a perfect, and when one thing is off, it throws everything else off.
True. I remember once years ago when I was a teenager, and I went to the dentist, and I'd had an ear infection. And he was like, well, we got to wait till that heals because all of this is connected.
All those two. That's why when people cry, their nose run. Think about it.
It's all connected.
Yes, it is. Yes, it is.
When you're stopped up and then your ear starts.
Yeah. Exactly.
All connected. So your thinking about your digestive system and all the things, like you said, things that we eat that affect so many other parts of our body.
Right.
So really, and just the when I was healing from my retinal surgery, and just how the brain had to adjust to my new
surroundings. Your sight. You got to think about it. Your sight gives you equilibrium. Your ears give you equilibrium. So if you aren't seeing correctly, you're off kilter. You're off kilter. You don't walk straight. People are like, you're not walking straight.
Yes. I wasn't walking straight. I was bumping into stuff. My depth perception was off.
That peripheral, people don't realize that. And that's why some people need their keys taken away from them. Their car keys.
They say you can drive with one eye. You can drive as long as it's 20/40 in Illinois, you can have one eye.
Well, they're supposed to test your peripheral,
right? Not
just straight ahead, because you should be able to see that car coming off on the side to you.
This is true.
Okay,
true. That's true. So, did we miss anything? I think we got you hit it all.
I
Weight
think
management.
My top 5 is heart disease, diabetes, cancer, osteoporosis. We talked about bone, because remember, osteoporosis, vitamin D and calcium. Make sure they're testing that. Do weight bearing exercises like walking and strengthening. It's okay to do strengthening. Everybody think I'm gonna build up my muscle. No, strengthening is actually nowadays they say yes, you can do your walking cardiovascular, but whether you do weight training to increase your bone density and cognitive decline. So that dealt with the mental health, but we start to notice as hormonal changes as you get older. You get cognitive decline. Basically, you ain't thinking straight. I mean, how many times we walk in a room and go, why did I come in here? Oh,
Right.
let me see. Or you need to you write things down, you write your list, and then you forget where the list is.
Yes. Been there. Been there.
The whole thing, like, where's my glasses at? I can't. Or people be like, girl, I got to get off the phone because I can't find my phone.
And you on the phone.
So yeah, you do start to have some cognitive decline. And of course, whether it's, it's not all Alzheimer's, some of it's Alzheimer's, some of the other part of dementia, some of it could be chemical related. Or, one thing we notice that when elderly people come in and they say, oh, they're confused, the first thing I check is their urine, because they probably got a urinary tract infection. Yes, so check that. But to keep things sharp, to keep that cognitive going, use the brain. That's the point. One, use the brain, whether you're learning a new skill, learning a new language, reading, taking a community class, and be social. You have to be social. And that's the problem too. People get in their house and they isolate themselves. They need to be social. That keeps your brain moving. And so once again, one of the things I do to travel, I'm gonna throw this in there. I tell people cultural immersion keeps the brain going. So if I go somewhere, I'm taking a group somewhere, we're gonna do something in that culture and learn a new skill, because that's stimulating the brain. We just got back from Japan. We had a baking class, and sushi is not what we think here in the United States. Their sushi is totally different. I was learning something totally new, and we're like, oh, did not know that. We go somewhere. Was that you with me on the cruise? We did the salsa dancing.
No,
that was somebody else. That was a different class. Yeah, that was another one. So we went somewhere and we made sure we did a salsa dancing class. Learn how to dance by their culture.
Yeah, or learn how they make. Like we did. I was somewhere and we learned how to do some of their weaving.
Right.
And then we did. I think it was in Jordan. We did some mosaics.
Okay.
And things like that.
Yeah. So I'm going to Morocco and I'm looking forward to doing some pottery. I've never done pottery before, but it's going to be something new I might have to learn. But that's what I'm looking forward to, going to Morocco.
That sounds like fun. So while you're talking about your travels, before we leave, just tell people a little bit about your tours and how they can find out more.
Okay, sure. So my company is called Med Queen, since I'm a doctor and I'm a queen. It's Med Queen, MED Queen Tours, TOURS.com, medqueentours.com. And I'm a concierge travel advisor. So I just don't say agent. I just don't book things. Well, I can curate it. So if it's just you want to do something private, you and your family or yourself, and you want to adventure, I do it according to your travel style. I like planning things according to people, not just say, oh, this is the typical thing they do, you should do it. No, it should be, you're paying for it. It's your time. You should enjoy it. And then my group travels, I try to go somewhere every 3 months. I have group travels where like I said, cultural immersion. And I'm also have been doing what I call the wonders of the world. And I know we always say the 7 wonders of the world, but there's actually more of the old 7 wonders of the world. There's the new 7 wonders of the world. And there's now what they call the living
wonders of the world.
Like one of the living ones is Victoria Falls in Zimbabwe, Zambia. So in the previous years, I'll take the large groups to, and this is usually a 2-week trip. I'll take them to, of course, we've done Egypt, we've done Rome, the Colosseum. We did Machu Picchu in Peru. We did Angkor Wat in Cambodia. So those type of wonders of the world. Cool. So yeah, medqueentours.com. You can find me there. If you want to, for me to plan something, even cruises, I do cruises too.
Yes, you do.
But my thing is, a lot of people feel cruises is all about partying, but cruises was what I think. I look at it as a mental health session because it's very relaxing, or just some of the destinations you go, you can also get immersed in their culture.
Yes, it is important. When I travel, it's the main thing is what can I learn from this trip, you know? And it's not just, sometimes it's not just being in the tourist spots, it's finding out how people live. And that is really interesting. We were just in Thailand, and so we did cooking. We did a cooking class. We also, of course, the Thai. We learned about Buddhism and how they practice, and so it was really, really an interesting trip. And then I didn't know that Thailand had several UNESCO World Heritage Sites.
Yes, they
So
do.
so we did visit a couple of those, and
Yes.
yeah, it's not just going to the
I
beach.
can't say Atta or whatever.
Out
ATTA.
of Thailand.
Yeah, that's it. Okay. When I go to places, I always want to know how their medical system work too.
Oh yeah, I'm sure. I used to do that as an educator. How do the
Right.
schools work? Can we visit a school?
Mm-hmm.
So yeah, learning. It's about learning, and of course,
About learning.
like you said, there are relaxation trips where you don't want to do anything.
Mm-hmm.
But if I'm traveling 15 hours on a plane, and I need to learn some stuff.
Mm-hmm.
Yeah.
So you can I could do a trip, you can join me, or either one, you can find me that way. But I'm gonna be about wellness. We're gonna walk. So be ready to walk.
That's me. I'm always on the go. Yeah. And then when I'm puckered out, I'm sitting down.
Right. You walk, you stay hydrated,
That's
and then you
important.
relax. And then relax.
Right.
And
And
you
don't
have your
overeat.
You're right. Don't overeat, but you have your downtime too.
Yeah, you're down
So
to.
I'm one of those people that don't want you to come back from a vacation and need a vacation. So you're gonna have down days too. Be like, oh, that's your free day. Do what you want to do. No, I don't know what to do, but bye.
Bye. Right. And when you come back, you're gonna have jet lag anyway. So
Yes.
you don't need to be extra tired. You're gonna
Yeah.
have jet lag. So we gave our audience a lot of information
Okay.
today, and hopefully people will take some of this information. Some hope people who haven't made those doctor appointments or those mammogram appointments or whatever other colonoscopy, which I need to do, get on that phone tomorrow morning and make that appointment, especially with specialists, because that could be a 2-month wait.
Yes.
Be 2-month, 3-month wait. So don't keep putting it to the side. Counseling, if you have insurance and you need counseling, find a counselor that fits your needs and make that appointment.
Well, even if you don't have insurance for counseling, or some people don't have insurance for a doctor either. If you find a doctor, see if you can make an agreement with them. What is your office visit? How much is your office visit? Is it, how much is the lab? Can I pay an installment? Something.
Yeah. And also check your Department of Aging for your state or for your city, because I'm amazed at what all they offer sometimes.
AARP, Department of Aging. Yes, you're right. That's
services that we don't take advantage of.
We don't take advantage of.
So right. Don't be ashamed. I know my dad used to ask all the time, what do you offer to seniors? And I used to say that, but now that I'm a singer, it's like, what do you offer?
What you got for me? Can I get my discount?
Exactly. Save you some money. That's another theme we can talk about, financial wellness.
Yes.
For people over 50. So
yes.
So we will say goodbye to our audience. I thank you again for all your wisdom and that you share it with us. And we'll think of a topic to do for our next time.
Okay, I'm here.
All right. Take care, everyone.
Ciao.